So many research indicated that the possibility of endocarditis or end arteritis in case of pacemaker, because as I mentioned before, pacemaker placed under the skin of the patient by surgical operation is very low. So since the possibility is very low, so in this case, prophylactic antibiotics might be not considered. However, we have to consult the patient physician to consider whether there is to give the patient prophylactic antibiotic or no. For patient also under or using pacemaker, degree of shielding. Sometimes we use in the dental clinic certain dental equipment, for example, dental scaler, or even the pulse tester. Since there is electrical currency, so this might be interfere with the function or with the action of the pacemaker. So we have to use shielding. Sometimes the physician might be, or the physician may not advise to use the dental scaler or pulse tester because there is electrical currency, and this might be interfered with the action of the pacemaker. So also we have to consider the degree of shielding regarding the pacemaker. Consider Coumadin. Actually, as I mentioned before, cardiac arrhythmia might be occurred in case of patient with ischemic heart disease or patient with ventricular heart disease. So in this case, in order to prevent arterial embolism, sometimes the patient might be given anticoagulants, Coumadin or warfarin, so to prevent coagulation of blood, or what we call to prevent arterial embolism. So in this case, we have to consider the Coumadin, which is anticoagulants. We have to discuss this point with the physician to reduce the dose of Coumadin and also to check prothrombin time or even the international normalized ratio in order to decrease the level of Coumadin or decrease the dose of Coumadin. And this is actually the responsibility of the physician and not the responsibility of dentist. Current status of underlying disease. As I mentioned before, cardiac arrhythmia might occur due to certain systemic disease, thyroid disease, in case of thyrotoxicosis, in case of ischemic heart disease, in case of obstructive pulmonary disease, in case of ventricular disease. All of these should be discussed with the patient physician because this is also might exaggerate the condition. So consultation include the patient with sinus symptom, the patient with pacemaker, and the patient who is who has certain underlying disease which is more susceptible to put the patient under the development of cardiac arrhythmia. Mental management identification. How we can identify a patient with cardiac arrhythmia? Undetected patient, we have to check the vital signs, pulse rate, blood pressure, respiratory rate, and body temperature. So if we notice that the pulse rapid or slow, or there is irregularity in the pulse, we have to refer the patient for physician. If there is any sinus symptom, so any patient with sinus symptom or irregular pulse or increase in the heart rate, it should be identified and referred for physician. The patient who mourns to develop cardiac arrhythmia, we have to ask the patient if he has any, if he has or she has any underlying disease, particularly thyroid disease, ischemic heart disease, cardiovascular hypertension, and also obstructive pulmonary disease. We have to ask the patient because those patients usually more risky to develop cardiac arrhythmia. So patient with ischemic heart disease, ventricular heart disease, thyroid, obstructive pulmonary disease, usually those patients more susceptible to develop cardiac arrhythmia, and we have to identify those patients and to refer them for consultation. The patient under medical treatment, the patient usually taking anti-arrhythmic drugs such as digoxin or propranolol. So those patients also we can identify the patient from the drug treatment. Patient with pacemaker, if the patient said that he or she using pacemakers or under pacemaker, so in this case we have to consider that the patient with cardiac arrhythmia. So any patient with sinus symptom regarding the pulse rate or other sinus symptom or clinical manifestation or sinus symptom, any patient who is susceptible to develop cardiac arrhythmia with this disease, and also the patient taking drugs or already detected or already under medical treatment, we have to identify those patients and to refer them for consultation with the patient physician. So this is the end of the lecture, and thank you for your attention.